How this technique works is during sexual intercourse, for someone who doesn't last long, when you feel like you're about to climax, you feel like you're almost there, what you should do, stop, hold your structure, squeeze the head as hard as you can. Don't let anything move, and then try to redirect your mind to something different. Think about a car accident. Think about your teacher. Think about someone pouring water on you. Think about something terrible.
Why are we thinking about these things when you're in lovemaking?
Men who are watching this thing know that. They actually think about something very weird. They think about someone hitting them with a stone. So they try to distract their minds from their urge to.
Hi guys, you're welcome to today's episode. So today we're going to talk about erectile dysfunction. I'm Dr. Nyamurunji Tunsime and you are?
Dr. Blair, I'm very excited about today's topic.
I know. It's very excited. So speaking of erectile dysfunction, this is basically Bambi. The penis doesn't be as excited as we are. So right now, tell us what erectile dysfunction is. How do you describe it? What does it entail?
So basically, if I'm to use it in the basic language, erectile dysfunction simply means it's a set of things. So you either having challenges getting an erection, you're taking very long, or when you get an erection, you can't sustain it. Or even the erection that you're getting is a weak erection. And also by the erectile dysfunction is actually broader. Most people think it has to do with the strength of the erection, you failing to sustain the erection. But it actually goes on to see even people who take long to recover between rounds. Because ideally, you shouldn't spend more than 2 minutes between rounds. But you find someone, after one round, they're gone.
Isn't 2 minutes like very little?
Ideally,
someone is supposed to recover within 2 minutes.
Yeah, within 2 minutes, they should actually be able to function again.
There must be so many men that have dysfunction then.
But if someone, gets done with one round and then they're taking hours and hours, they go take a shower, you stimulate, you do what, and nothing happens. But worry not. Today, we are going to have a discussion onto the thick of it with regards to erectile dysfunction and then premature ejaculation. What do you think premature ejaculation is?
So basically, this is someone who tends to ejaculate earlier than the time. So I think normally we have a period of between, some men will say 3 to 7 minutes or 3 to 10 minutes of during the time. So sometimes someone can go below 3 minutes, so like 2 minutes or no, and the person is already having ejaculation. Some people even you find during the stimulation process or during, how do they call it? That first stimulatory phase and someone already gets an ejaculation. That is not okay. So yeah.
You think it's very common?
Very, very. I think it's extremely, really common.
Very, very common.
Very common.
On a daily, I get up to 10, 15 inboxes of different men asking me how to deal with it. So it's very, very troublesome. And I hope with the discussion we're going to have, we get to dive into the
very true,
thick of it.
Very true, because I think that it's at the other end of the spectrum, which has hypersexuality, is much, much less. Where you find someone who not even hypersexual, but a prolonged. Some people have a very, very, very abnormally lengthy period of time, and that is on the lesser end, which most people would want, but it becomes very hectic, eh?
Yeah, the delayed ejaculation.
Very delayed.
Some men take pride in it, but you taking longer than 1 hour,
it becomes exhausting to the partner.
It's exhausting. And it's not normal.
Very true.
Yeah. But just in the interest of time, we're just going to go directly into the common causes of erectile dysfunction and premature ejaculation. And I think from my practice, I've seen that what is to blame are the underlying medical conditions, definitely. So you find that it's either an illness that you're having or actually the medication you're taking to treat that illness are the ones contributing to the erectile dysfunction. What have you seen commonly, Dr. Brianna?
I think the number one, I think because of being a female, very few men will come to talk to a female doctor about it. Another thing is a female who is actually younger, it becomes even more complicated. But I think maybe the ones who would come and upwardly tell you that I have this problem, and the elderly male. The ones who have actually seen it, the really elderly ones, or the ones who are actually sick, especially the ones that have talked about it as a diabetic patients. Those ones tend to be a bit more comfortable with it. But even when I'm dealing with the younger men and they have like a problem, anything to do with down there, whether there's a funny discharge or there's some sort of pain, you see there's some bit of tension. And I understand it can be a very sensitive topic to talk to about.
I mean, Andrew Tate put it out there, you're either an alpha male or you're those of the betas.
But I feel like there's an in-between. Don't there's an in-between?
And it should be, but it's you're either alpha or not alpha. Yeah.
Okay.
But at least we've seen that commonly. Back then, like 20, 30 years ago, it was very unheard of to see a 19-year-old or 21 or 25 struggling with erectile dysfunction. It used to be a condition of the old.
Very true.
The older you get, the more you get these chronic illnesses.
Testosterone decreases.
The level of testosterone decreases. And now these days, surprisingly, you're finding a 21-year-old struggling with erectile dysfunction.
Chips and chicken, daddies, KFC. The food actually has a very big attribution to that. As a very big attribution, because actually in some of the foods that help to increase the testosterone levels, or some of the things supposed to do to increase testosterone levels, the things that, number one, things like exercise, and then the foods that you do eat. Foods that are nurturing, protein, healthy fat, these are the foods that are good. So normally that's why Paul used to talk about GNATs being associated with the Manigachi Sajai, things like, I think there is a Nigerian, is it Nigerian or Ghanaian? I think the tiger nut, it's something called a tiger nut that they use for, it's supposed to give men manpower. But it makes sense because these are healthy fats that are actually very good for this. Other than these days whereby you find everyone is onto the junk food train and all these things, it really does affect.
Also, I feel like technology has had a very big impact. Most of that, back then people just used to, throw on a back cloth and they walk around. But now these days, men are sleeping with phones in the pockets, vibrations. I kind of feel like it has an impact.
Very true. Then the skinny jeans. The skinny jeans, the tight pants and all these things do not allow the balls to breathe. And the balls, or the testes, are very, very temperature sensitive. So once you keep putting them in areas that are very tight and very cold, they eventually begin to get problems.
Don't you think that we are missing the elephant in the room?
What's the
Masturbation.
Definitely.
You can't talk about erectile dysfunction
without talking about masturbation. Very true.
Which has affected most of the young men that we see. Pornography is one of the leading factors. Young people are dwelling into pornography day in, day out.
Very
and
true.
What happens? Self-pleasure. Self-pleasure has had big impact. It really has big impacts when it comes to sexuality. Don't you think?
Very true. I think actually, especially what the masturbation affects extremely a lot to do with the psychosexual or psychosocial, someone's mentality. Because now when someone is, because the pornography and the internet has a lot of variety of what it is they present to you. There is, all sorts of people. And so eventually you begin to find that the ordinary girl or the ordinary woman doesn't really, really amuse you. So even when you look at the woman, it doesn't really give you any sort of like pleasure or interest.
Expectations. You want to pull the show that you saw on Pornhub today. And people are just not about that life, honestly. Yeah, I think it has had a very big impact because you find that most boys or young men are actually aiming to have what they have seen on screen because that's a script.
Very
to just
true.
take the whole script they watched.
Very
for 10,
true.
20
And
minutes.
people are using drugs and stimulants, enhancers, and they're trying to compete those with your natural remedies.
Yeah. So performance anxiety.
Very true.
Really has a very big part to play. Now, moving away from that, we've seen the lifestyle choices that people have had. The diet, people don't want to go to the gym. That has had a very, very huge impact. So, I mean, the gym has a very big role to play when it comes to that. So I think, but as we're trying to wind up with our discussion, what do you think can be done different? Or is there treatment? Or there's no hope?
No. There is definitely hope. And I always say that 50% of the solution is looking for help in the first place and acknowledge that you have a problem. When someone has a problem, there is so many treatment modalities. Number one we have with the beginning, depending on someone's issue. What is the issue in the first place? If it is things like pornography and whatnot, now this is things where someone has to deal with counseling because they actually have an addiction problem. Yeah, and then number two, we have drugs. There are different types of drugs. The drugs we're talking about.
Before we go to the drugs, we have behavioral techniques.
Very true.
I'm telling you. Now, for me as men, you women may never know. But when it comes to behavioral techniques, we have what we call the stop, hold, squeeze, and resume. I know this technique works. Trust me, it works.
Tell us about it.
How this technique works is during sexual intercourse, for someone who doesn't last long, when you feel like you're about to climax, you feel like you're almost there, what you should do, stop, hold your structure, squeeze the head as hard as you can. Squeeze until the urge to climax disappears kabisa.
Interesting.
When the urge is gone, that's why we say
then you resume.
Stop, hold,
squeeze, resume,
and then resume. It really does magic.
Oh, okay.
And every time you squeeze, it gives you almost 3 to 4 minutes. So just imagine. So if you've been having challenges, going, for at least 10 minutes, I think that's a technique that can aid many people. Yeah, then also the stop technique. So you just stop, don't let anything move, and then try to redirect your mind to something different. Think about a car accident. Think about your teacher. Think about someone pouring water on you. Think about something terrible.
Why are we thinking about these things when you're in lovemaking?
Men who are watching this thing know that. They actually think about something very weird. They think about someone hitting them with a stone. So they try to distract their minds from their urge to climax.
Do you know what that makes me think about? You've seen that there's a meme that had been going around of when a guy is about to climax and he has like the last 2 seconds and he's in the breaking point, and then the lady's like even her, she's also but you see, the thing is that women now, the female orgasm is much more complicated, and like it really comes from much farther than the male orgasm. Now when you find that now you do the stop start technique, now when you stop and start, you're going to now hinder the female. I know. Now she's going to for a female, remember she took like a good 30 minutes to get to where you were. Now, you're starting to get an extra 3-4 minutes. This is going to please you, but how is it going to help the woman?
I don't know, but as men, men will have to put up a show. We have to put up a show. For men who want to put up a show, behavioral techniques, but when you go to the medication that you've been talking about, what exactly can they use?
Interesting. So actually now that you said even we first wait for the medication, there is Kegel exercises for men as well. So these are basically pelvic floor exercises. I think sometime Dr. Blair will illustrate for us sometime. But it's basically almost similar to how females do Kegel. I could be seated here and I'm doing Kegel right now. I mean, I could be doing Kegel.
So basically what Kegel is, just feel like you're about to pee or you're about to pass stool. Then as you're trying to pee, you hold it. So you hold it so that you tighten your pelvic muscles and the cranial muscles. So that gives you control actually over ejaculation.
Very true. I think also there's also a technique whereby you lie down flat, and then when you lie down flat, your knees are flexed. And so it's almost like when a woman is going to push in a way. And then you pull and you try to feel like you're pulling your ball sack inside your pelvis. When you do this, you then hold it for like 5 seconds and then you release at once. And then you pull and then you release at once. These things help to strengthen the pelvic floor muscles, which helps also, I think, in that.
It gives you back your control. When it comes to ejaculation, it's all about control.
Very
As
true.
a man, you should be able to control it. You should be able to postpone when you're going to ejaculate. Not like for you, every time you feel like you're about there, like, I'm coming, it doesn't stop. So you need to have some bit of control.
Technique.
So techniques give you a bit of control, regain the control.
Very true.
As we wind up with that discussion, what are some of the medications that are commonly used on market?
I think most of the people actually know them. We have most of the sildenafils, and these are the sildenafils and the Viagra drugs. And then these are drugs that we normally. So normally sildenafil is our first line. Sildenafil does not work. We can move it a bit to tadalafil. However, when the tadalafil, the good thing is that it has a longer half-life. So it, in simple terms, it lasts a bit longer and it's a bit safer, although of course it's on the pricier end. Even when medications are now done, there are other modifications. There are other injections that they pierce direct into the penis and help in vasodilation. And then there's also more invasive, depending on how much you actually want to stop this.
And have implants.
We have penile implants as well. And then we also have those rings. They're those rings that they put at the base of the penis. I think those ones actually work more for the older men.
We call it beefing. Beefing comes with problems. Not every time you put that ring, because you have to make sure that ring, you pass the balls first. Then you put the penis so that it tightens at the end. Now the problem is if it's too tight, you can have ischemia, you can have tissue death.
There's blood
So
supply
it's a bit
cut
of
off.
troublesome, yeah. But you know, something much more simpler is we have lignocaine creams that can be applied on the penis for those of you who are very, very sensitive, so that it makes you less sensitive and you can push for a bit of time.
But if you're less sensitive, aren't you going to enjoy less?
No.
Isn't the pleasure also reduced?
For those of you who are very sensitive, so if you reduce the sensations, you come less. You take a bit of time to come. Now that's what condoms gives people. So if a person who lasts for a short time,
uses
you
condoms.
see that you last longer with
Yeah,
a condom
very true.
because there's limited contact, nyama kwa nyama, muscle kwa muscle, limited contact. Now you see, if it is bare knuckle, muscle to muscle, trust me, it'll take a shorter time because it feels different.
Okay.
Now for those of you who are very, very sensitive, in that the moment you enter there, you feel the warmth, you feel that.
Please, let's not illustrate, but
that condoms really help a lot. Things that make you less
sensitive, which makes sense.
Of course, the pleasure will be a bit reduced, but at least you try to pleasure your partner in the long run. Yeah. So you're saying that it's more on the selfless part of it. I know, sex, it's all about, for men, it's all about pleasing women. Say what or not, but for men, honestly.
I feel like, do you know that is actually, I don't think that's true. Because when women and young girls are being trained and all these funny traditional practices are made, they are to please men. And then men are supposed to be pleased and they please themselves. The same thing you're talking about at the stop, start, hold. Stop, start, hold is for you.
Can I give you a fact? But from the time a man enters inside you, for him, it's a battle to fight, not to come. You can ask all the men. For them, it's a battle now. They now fight.
Why are we fighting?
They want to please you.
Oh Lord, have mercy.
Otherwise, if it was about us, as I say, for us, our ejaculation takes less than. If we want, in 3 minutes we can be done. But now we keep on pushing so that we make you happy. But others, if it was about us, bro, we'll be done in like 2-3 minutes and we'll be like, bye.
So in simple terms, you're saying, if you'd have a woman and you're trying to please the woman, because the women's orgasm takes much longer. Some women even gets to an hour plus and she's untouched.
I'd be out of it.
So what we do normally, what is recommended is a lot of foreplay. So a lot of foreplay, especially with the different things, and communicate during the process. A lot of foreplay, discuss during the process, and then have a lot of because when you do have foreplay, you're going to keep going towards closer to her threshold. So that by the time now you begin to penetrate and have your acts on all these things, then eventually you find at least you're much closer to her threshold than you are if you started from here. Because if this is the threshold, a woman is going to be here while a man is here. So you try to keep foreplay and at least get to this level. If you can get here, perfect, that you can move together. But then and then when you're into the process, then you can do as you please. And I think at the end of the day, beautiful and healthy sex is when both partners are pleased, and when erectile dysfunctions are not in the picture, everyone is excited and happy, right?
So I think with that, with a few words, maybe like my brothers, the Banyanko, after speaking of that in a specific few words.
For 5 hours.
For 5 hours. With the few words that we've spoken, we're very happy that we are, at least we've learned something, we've shared something out there. Don't forget, what are the simple rules? What is the simple rule that we have?
MedExpo.
MedExpo. So we have the MedExpo coming up. Don't miss from September.
7th to 9th of September. Umalugogo.
Umalugogo.
Yes.
Only 5,000. And we have you. Thank you.
Thank you very much.